Mayor Watson, welcome to the West Block. Thank you for joining us.
Thank you. Welcome to City Hall.
Well, you are the mayor of a city that has been all over the news for the last week because of the long lines in testing centers. Testing centers that in some cases were closing at noon, people waiting 8 hours in line, still not able to get in. What are your thoughts on those lineups?
Very frustrated, not happy. I recognize that our staff are working their hearts out, the nurses and paramedics and so on. But clearly we have a capacity problem, and we're not alone. I've seen lineups in Calgary and Toronto and so on. So we are certainly working very hard with the province, who have the main responsibility for running these assessment centers, test centers, to get more capacity. Today we'll have 3 pop-up centers that are going to be available. They'll be able to test another, I believe, 100 people at each pop-up site. We need to get a test site in the east end of the city. Our city is very large. I have a map in my office that I've had the planning staff superimpose the cities of Vancouver, Calgary, Edmonton, Toronto, Montreal. All 5 of those large cities fit within the geographic boundaries of the city of Ottawa. We're 2,600 square kilometers, and we can't expect everyone to come to 1 or 2 sites. We need sites in the east end, the west end, the south end, and another downtown site.
So then I guess my next question is, why weren't you better prepared? Why wasn't the province better prepared? We all knew there was likely to be a spike in numbers in the fall, and yet it seems like during that lull in the summer, people didn't take advantage of that to prepare and set up more testing centers.
Well, we wrote to the province and provincial officials back in August saying we knew there was going to be a big spike in testing once schools open. You didn't have to be a genius to figure that one out. And unfortunately, we're scrambling now. And the cities are looked at to deliver this service. Unfortunately, it's the province and the hospital system that run that. We're doing everything we can by providing facilities and providing extra staff to help with the lineups. But clearly, it's not satisfactory to any of us to have these people line up. We've been lucky. The weather's been relatively nice this week. But certainly when it comes to November, and the snow starts falling, we better have our act together well before then. So I'm confident. I've spoken with the 4 hospital presidents. I spoke with the Premier. I have another meeting with him in a few minutes. And they understand the severity of the problem, and they have to get that capacity issue resolved literally within the next week or so, because the public don't want to be in lineups in cold weather. The other thing that our Medical Officer of Health, Dr. Etches, has stressed, if you don't have the symptoms, please don't show up.
Well, I think that's where part of the problem comes from, because you hear, for example, Premier Doug Ford saying, everybody go get tested, but then you can't get tested, and then the medical officer in health in one of the cities is saying, well, no, if you don't have symptoms, don't get tested. So how do people know who to listen to?
Yeah, look, I have great respect for Doug Ford and the work he's done. We have a very good working relationship. This is one area where I'm going to go with the Medical Officer of Health. If you don't need the test, you don't have the symptoms, go to ottawapublichealth.ca for information on what those symptoms are, and don't show up. And if one person in your household has the symptoms, you don't have to have the whole household tested. So listen to your Medical Officer of Health. I think, Premier Ford probably was saying, several weeks ago, when there weren't the lineups, go and get tested. Now we have to pivot a little bit and say, if you don't have the symptoms, don't show up. One doctor told me that it's close to 90% of the people at our main assessment site that don't have to be there. Can you imagine if we got rid of 90% of the people who don't have to be there, and there would be no lineups? We'd be operating a much more efficient system. The other thing is, the Premier's looking into this, and I support him on it. We need to get the pharmacies involved. They do flu shots. They could be doing swabs, and that would take a lot of pressure off the main centers and get people into their local pharmacies. There's more Shoppers, Drug Marts, and Rexalls than Tim Hortons in the province of Ontario, so there's lots of capacity geographically spread around.
One of the things that we're expecting here in Ottawa and also in Toronto and Peel region is a step backwards in terms of gathering spaces. There's just too high of numbers, the Premier is saying. COVID is growing too quickly, so we have to put more restrictions on. What are your thoughts on that?
100% agree with them. I spoke with the Premier about a week and a half ago, and I said the biggest problem we have are not bars, restaurants, and gyms. There's been no transmitted cases from those 3 enterprises, but there have been lots of problems with parties in private residences and private homes and backyards, barbecues, keg parties, and so on. Those have to stop. The old provincial guideline was you allow 50 people in your house. Well, unless you live in a mansion, 50 people in my house, we'd all be jammed together. There'd be no social distancing. So he's brought that number from 50 down to 10 in a private home. And we asked for 20 outside your backyard. He's brought it to 25. So it's a good compromise. And that starts today. And I'm glad that he brought that in because, you know, myself and Mayor Tory and other mayors from around the so-called hotspots have said, let's nip those in the bud because that's causing a lot of grief. And a $10,000 fine if you host a party, and if you're at the party, $750. That's an expensive lesson, but we have to do it. This is the most serious health challenge our generation has faced. And I'm sorry, you don't need a keg party this year. Put it off until we're rid of COVID-19.
Do you think there will be another full lockdown in Ottawa?
I hope not. No one knows. No one can answer that with any degree of certainty because this is a moving target. You know, yesterday we were down in the 30s. The day before we were in the 60s. So we're up and down. You know, I have to remind people, why are we a hotspot and why is Toronto and why is Peel? We're the 3 largest jurisdictions in the province. So of course, that makes sense. It equates to larger number of people than you'd see in Pembroke or Lindsay or Sarnia. So the reality is that the bars and restaurants, by and large, have been doing a very good job social distancing their tables. We eliminated patio fees, for instance, extended the patio season to help them as best as we could at the municipal level. But at the end of the day, we have to make sure those bartenders and restaurant waiters and waitresses are wearing masks, they physically distance, they minimize the clutter on the table, and they have hand sanitizing stations for both employees and for residents and customers. And it's working. You know, most of the restaurants, as I said, have not been a problem. But those who are, I was in a restaurant yesterday visiting some local businesses. The 2 people in the back of the shawarma restaurant were cooking without masks, and I told the owner, he said, oh, I don't think they have to wear masks because they're not in touch with the people. I said, they're in touch with the food. And I said, let me just give you advice, put the masks on because bylaw is coming around and there's no more warnings. It's now a fine. You know, we've tried to warn through education, but at the end of the day, we have to be it's a little bit tough love, you know, because this is a serious, serious pandemic.
The throne speech is coming up next week. Could be MPs from all across the country coming in. Does that worry you as the mayor of Ottawa?
Well, look, you know, we're a tourism town as well. Tourism numbers are down, but there are still tourists that come into Ottawa, visitors, and we welcome them. And the hotels and the restaurants are doing a very good job of making sure we follow the principles of being COVID-wise. You know, I know the House still has the rules in terms of the number of people in the House, which is good. I hope they don't allow everyone back in because that it completely defies what we've been trying to do in terms of social distancing. But you know, this is part of the reality of governing. You know, I don't know how they're going to cram into the Senate as they normally do, where you see the Speaker at the bar. My hope is that they respect the municipal rules, even though they're not required to, because at the end of the day, if they come in and start contracting COVID-19 and spread it to other residents, that's not good for them and it's not good for our city.
As the mayor of Ottawa, what would you like to see for cities in the throne speech? Because I know a lot of cities have been really hard hit with this. There's concerns about whether or not you'll be able to keep rec centers, arenas open, services, transit, all being hit hard by COVID.
Yeah, we're losing $1 million a day at the City of Ottawa, so we anticipated a $192 million deficit, which, as you know, we're not allowed to run a deficit. I give credit to Prime Minister Trudeau and Premier Ford. They came to the table with, for us, about $124 million. We're still short about $65 million. We have the ability to apply for that from the province, and we feel confident that they will make us whole by the end of the fiscal year, which is December 31st. We need continued support because ridership is not magically going to go up on our transit system on January 1st, which is the start of our new fiscal year. So we need support, as we've seen the last few months, continue that goodwill and that cooperative approach with all 3 levels of government working together, number one. And secondly, we continue to need support for housing. We've seen with COVID-19 the tragedy of homelessness in every single municipality across the country. With the cold weather coming, we can't have people living on the streets. So we need a massive infusion of new dollars. We just were with Minister Hussein and Minister McKenna doing an announcement for 700 units in our central core, which is great. But we have over 10,000 people on a wait list, and Toronto's even worse shape, and of course Vancouver has some real challenges too. So housing and continued operating dollars for transit and for operations, because we're really the level of government that's on the front line. You know, no disrespect to the province or the feds. It's local people running paramedic service, police service, and the testing site on behalf of the hospital system.
Mayor Watson, thank you for joining us on the West Block for our outdoor socially distant interview. Please stay safe and healthy.
Yeah, you too. Thank you.